Hi, my name is Dr. Jennifer Kolb. I'm a longtime PA, fierce healthcare advocate, and the current Chief Medical Officer of the American Academy of Physician Associates. Fast forward with me. It's the year 2035. Healthcare teams look nothing like they did in the 1970s or even in the 2020s. And that may be a good thing. Because if there's one truth we've learned, it's that medicine cannot stay frozen in time while the world changes around it. I anticipate that healthcare teams of the future will be more team-based, technology-enabled, and community-driven. And by my estimation, PAs will be at the center of that change. By 2036, there will be more than 234,000 practicing physician associates in the US, outpacing the growth of nearly every other health profession. And they won't be working on the sidelines. We talked in the previous video about how nearly half of PAs are now serving in leadership roles, directing practices, leading hospital units, managing care teams. And here's a striking projection. Within the next decade, PAs and nurse practitioners together will make up nearly half of all providers in America. That's not just a workforce statistic. It's a structural transformation of who delivers care, how care is delivered, and where it happens. So why does this matter? It matters because for the first time in over a century, we have an opportunity to reimagine our healthcare system from the ground up. And it matters because the demands on healthcare are growing faster than any single profession can keep up. Over 100 million Americans today lack access to adequate primary care or mental health care. Chronic diseases are on the rise and represent an ongoing public health issue, with nearly 60% of US adults living with at least one chronic condition and another 40% managing multiple chronic conditions. Our population is aging, with approximately 58 million Americans being over the age of 65, expected to increase to almost 81 million by 2050. And here's the kicker. Experts say medical knowledge itself now doubles approximately every 73 days. That means no one provider can possibly keep pace alone. We need teams that are nimble, adaptive, and built on shared leadership. Teams where every member practices to the top of their training, education, and license. So, what will healthcare teams look like in 2035? In my vision, they will be collaborative, high-functioning teams, not hierarchical ones. They will be technology-enabled using AI, digital tools, and virtual care, coupled with human hearts and minds to expand reach. It will be community-driven, meeting patients where they are, whether that's a hospital, a community clinic, or right in their homes. And above all, equitable, designed to deliver care in underserved areas that need it most. But here's the critical point. These future teams aren't going to build themselves. Systems that begin today by breaking down outdated hierarchies and fostering environments that produce and embrace diversity of thought. Those are the systems where patients and the teams that lead them will win. Way to make a complex solution sound simple, right? In the next video, we will explore some practical solutions that employers can take now to work toward the teams of the future.